Hello, everyone. Before we start, make sure to like and subscribe to the channel and leave a comment with where you're from and what time you're watching. That way, YouTube will keep showing you stories just like this one. Now, let's begin. I'm a neurosurgeon at Cedars-Sinai Medical Center in Los Angeles, California. Or at least I was until I submitted my resignation last month. You can call me Dr. Sarah Chen if you want, though most people in the OR just called me Doc during my 18 years there. I've seen everything you can imagine in neurosurgery. Traumatic brain injuries, complex tumor removals, aneurysm repairs, spinal cord surgeries, and every kind of damage the human brain and nervous system can endure. But what I'm about to tell you about is the one case that made me question everything I thought I knew about the human brain, and ultimately led me to leave the profession entirely. Cedars-Sinai is one of the premier medical centers on the West Coast, serving not just Los Angeles, but patients who fly in from around the world for our specialized neurological services. It's a state-of-the-art facility with some of the most advanced surgical equipment and imaging technology available anywhere. During my time there, I performed over 3,000 brain surgeries, consulted on thousands more cases, and trained dozens of residents who have gone on to become accomplished neurosurgeons themselves. I thought I had seen it all. The case I'm about to tell you about began on a Tuesday morning in March of 2023. It was one of those perfect California days where the smog had cleared and you could actually see the mountains from the hospital windows. I was reviewing surgical schedules in my office when my pager went off at 7:42 a.m. The message was from Dr. Michael Rodriguez, our chief of emergency medicine, who I had worked with on countless trauma cases over the years. The page simply said, "Incoming trauma, possible neurosurgical consult needed, ETA 8 minutes." I made my way down to the trauma bay where the emergency team was already preparing for the patient's arrival. The paramedics had called ahead with preliminary information that immediately caught my attention. Female patient, approximately 28 years old, found unconscious in her apartment by a neighbor who had become concerned when she didn't show up for work. The patient had no obvious external injuries, no signs of trauma, but she was completely unresponsive with abnormal neurological signs that suggested serious brain involvement. What made this case unusual from the start was the complete absence of any clear cause for her condition. No evidence of a fall, no signs of drug or alcohol use, no medical history of seizures or other neurological conditions. She was simply a healthy young woman who had apparently lost consciousness for unknown reasons sometime during the night. The ambulance arrived at 7:50 a.m. and wheeled in a patient who would challenge everything I thought I understood about neurosurgery. The woman appeared to be in her late 20s with shoulder-length brown hair and no visible injuries or trauma. But her neurological presentation was unlike anything I had encountered in nearly 2 decades of practice. She was completely unresponsive to verbal commands and showed no reaction to painful stimuli. Her pupils were equal and reactive to light, which was encouraging, but her muscle tone was abnormal. Not the flaccid paralysis you might expect from a stroke or the rigid posturing associated with severe brain injury, but something in between that didn't fit any standard neurological pattern I knew. Dr. Rodriguez briefed me as we began our initial assessment. The neighbor found her around 6:30 this morning when she went to check on her after she didn't answer her phone or show up for work. The apartment was undisturbed, no signs of struggle, no evidence of anything unusual. She was lying in her bed fully clothed from the previous day, as if she had simply laid down and lost consciousness. I began my neurological examination while the trauma team worked to stabilize her vital signs and get baseline labs drawn. Her reflexes were present but hyperactive, almost exaggerated in a way that suggested her nervous system was functioning but somehow overactive. When I tested her response to light touch, she would occasionally grimace or move slightly. But there was no purposeful movement or any indication that she was consciously aware of the stimulation. Most puzzling was her breathing pattern. She was breathing on her own without assistance, which indicated that her brainstem was intact, but the rhythm was unusual. Instead of the regular, consistent breathing you would expect, she would take several normal breaths, followed by a brief pause, then resume breathing normally. It wasn't quite the abnormal breathing patterns associated with specific types of brain damage, but it wasn't normal either. We immediately ordered a full neurological workup, CT scan of the head, MRI of the brain and cervical spine, comprehensive blood panel including toxicology screening, lumbar puncture to check for infection or bleeding, and EEG to monitor brainwave activity. While we waited for results, I continued my physical examination and found more inconsistencies that defied easy explanation. Her muscle strength was difficult to assess given her unresponsive state, but when I moved her limbs to test for resistance or spasticity, I encountered something I had never felt before. Her muscles weren't paralyzed, weren't spastic, weren't rigid, but they had an almost elastic quality to them, as if they were responding to movement in a way that seemed almost deliberate despite her apparent unconsciousness. Dr. Chen, the CT results are back, called Jennifer Walsh, one of our senior nurses. The images showed a completely normal brain. No signs of bleeding, no evidence of stroke, no tumors, no swelling, no structural abnormalities of any kind. For someone who was completely unresponsive, having a normal CT scan was highly unusual and raised more questions than it answered. The blood work came back equally puzzling. No signs of infection, no electrolyte imbalances, no evidence of drug or alcohol intoxication, no indication of metabolic disorders that could cause altered consciousness. Her glucose levels were normal, her liver and kidney function were perfect, and even her inflammatory markers showed no signs of any systemic illness. Most neurologists would expect to find something abnormal in a completely unresponsive patient, some indication of what was causing the loss of consciousness, some clue that would a diagnosis and point toward treatment plan. But this patient's initial workup showed a perfectly healthy young woman whose brain and body appeared to be functioning normally despite her complete lack of responsiveness. The MRI results, which came back about 2 hours later, were even more confounding. Not only was her brain structurally normal, but the detailed imaging showed excellent blood flow, no signs of microscopic damage, and normal signal patterns throughout all regions of the brain. The cervical spine images ruled out any spinal cord injury that might explain her condition. I had never seen such a disconnect between a patient's clinical presentation and their diagnostic studies. Everything we could measure suggested a healthy, normal brain in a healthy, normal body. Yet the patient lying in our trauma bay was completely unresponsive to the world around her. The EEG results, however, were where things became truly extraordinary. Instead of showing the abnormal brainwave patterns I expected, or even the flat lines that might indicate severe brain damage, the monitoring revealed something I had never seen in my entire career. Her brain was producing highly organized, rhythmic electrical activity, but at frequencies and in patterns that didn't correspond to any known states of consciousness. Normal brain waves during wakefulness typically show irregular, mixed-frequency activity as different parts of the brain communicate and process information. Sleep produces more organized patterns with characteristic waveforms that we can easily recognize and categorize. But this patient's brain was generating perfectly synchronized, highly complex wave patterns that seemed almost musical in their organization and rhythm. Dr. Patricia Williams, our chief neurophysiologist, was called in to interpret the EEG findings. She'd been studying brain waves for over 25 years and had seen thousands of abnormal recordings, but she was as baffled as I was by what we were observing. "Sarah, I've never seen anything like this," she told me as we reviewed the continuous monitoring strips. "These aren't seizure patterns, they're not coma patterns, they're not sleep patterns, and they're certainly not normal waking patterns. It's as if her brain is operating in some kind of state that we don't have a medical term for." The patterns were so consistent and organized that Dr. Williams initially thought there might be a malfunction with our EEG equipment. She ran diagnostics on the machine, replaced the electrodes, and even switched to a backup monitoring system. Every test showed the same impossible results. This patient's brain was producing electrical activity that seemed to follow mathematical principles we couldn't understand. What made it even more remarkable was that the patterns weren't static. They evolved and changed over time, but always maintained their perfect organization and synchronization. It was as if we were watching a symphony being conducted inside her skull, with different regions of her brain playing their parts in perfect harmony. I decided to try something unconventional. Instead of relying solely on standard neurological tests, I began talking to the patient directly, even though she showed no signs of being able to hear or respond to me. I explained what we were doing, described the tests we had performed, and asked simple questions that she could theoretically answer with basic movements if she was somehow aware. To my surprise, within minutes of beginning this one-sided conversation, her EEG patterns began to shift. The mathematical precision remained, but the frequencies changed, almost as if her brain was responding to the sound of human speech in ways our instruments could detect, but her body couldn't demonstrate. "This is unprecedented," Dr. Williams whispered as we watched the real-time monitoring. "Her brain activity is changing in response to auditory stimuli, but she's showing no clinical signs of consciousness whatsoever. I've never seen a disconnect like this between brain function and behavioral response." I continued talking to the patient, varying my tone and the complexity of what I was saying. Each change in my speech produced corresponding changes in her brainwave patterns. When I spoke in a calm, reassuring voice, the frequencies became more regular and organized. When I raised my voice or spoke more urgently, the patterns became more complex and rapid. Most remarkably, when I asked direct questions, there were distinct changes in her EEG that occurred precisely when someone would normally process the question and formulate a response. Her brain was clearly receiving, processing, and reacting to information. But none of that activity was translating into any observable physical response. By afternoon, word of our unusual case had spread throughout the hospital. Colleagues from neurology, psychiatry, and even research departments began stopping by to observe the patient and review her test results. Everyone who examined her came away with the same baffled expression I had been wearing all day. Dr. Robert Martinez, our department chief and one of the most experienced neurosurgeons on the West Coast, spent over an hour reviewing every aspect of the case. He performed his own neurological examination, studied all the imaging studies, and observed the EEG patterns for an extended period. "Sarah," he told me privately afterward, "in 40 years of neurosurgery, I've never encountered anything that challenges our understanding of consciousness like this case does. Everything we know about how the brain works suggests this patient should either be awake and responsive, or her brain should show clear signs of damage or dysfunction. She seems to exist in some middle ground that shouldn't be medically possible." That evening, I made the decision to stay overnight at the hospital to continue monitoring the patient personally. Something about her case was nagging at me, a feeling that we were missing something important that might become apparent with extended observation. Around 2 a.m., as I was reviewing her charts for the 100th time, something extraordinary happened. The patient's eyes opened. Not the blank, unfocused stare you might expect from someone in an altered state of consciousness, but clear, intelligent eyes that immediately found mine across the room. I approached her bed slowly, uncertain what to expect. Her eyes tracked my movement perfectly, maintaining eye contact with an intensity that was both encouraging and slightly unnerving. But when I spoke to her, asked her simple questions, or requested basic responses like squeezing my hand, there was nothing. Her eyes remained alert and focused, but her body showed no sign of voluntary movement or response. The disconnect was profoundly unsettling. I was looking into the eyes of someone who was clearly present and aware, yet trapped in a body that wouldn't respond to her conscious will. It was as if her consciousness had become separated from her physical form in a way that defied every medical principle I knew. Over the next hour, I conducted every test I could think of while maintaining eye contact with the patient. I asked her to blink once for yes and twice for no, but got no response. I requested that she move her fingers, turn her head, or make any voluntary movement, but her body remained unresponsive despite the obvious intelligence behind her eyes. What disturbed me most was the expression in her eyes. There was no confusion, no fear, no frustration that you would expect from someone trapped in an unresponsive body. Instead, there was something that looked almost like curiosity, as if she was studying me with the same intensity that I was studying her. Around 3:30 a.m., her eyes closed again, and she returned to her previous unresponsive state, but the EEG patterns continued showing the same organized, complex activity that suggested ongoing consciousness despite her apparent unconsciousness. I spent the rest of that night questioning everything I thought I knew about the relationship between brain function and consciousness. Medical school had taught me that consciousness was simply the result of properly functioning neural networks. If the brain was healthy and active, consciousness should be present and observable. If consciousness was present, it should be demonstrable through behavior and response to stimuli. But this patient seemed to exist in a state that challenged those fundamental assumptions. Her brain was clearly functional, her consciousness appeared to be intact based on her eye contact and EEG patterns, yet she remained unable to interact with the physical world in any meaningful way. The following morning brought a parade of specialists who had heard about our impossible patient. Dr. Amanda Foster from UCLA's Consciousness Research Laboratory arrived first, followed by Dr. James Kim, a neuropsychiatrist who specialized in rare neurological conditions, and even Dr. Susan Wright, who had flown in from Johns Hopkins specifically to examine this case. Each expert brought their own theories and diagnostic approaches, but none could explain what we were witnessing. Dr. Foster had studied consciousness for over 15 years and had published extensively on disorders of awareness. She spent 3 hours with the patient, conducting every consciousness assessment tool in existence. "Sarah, this patient doesn't fit into any category we have," she told me as we reviewed her findings. "She's not in a coma, she's not in a vegetative state, she's not locked in syndrome, and she's certainly not malingering. Her brain is functioning at levels that suggest full consciousness, yet she exists in this strange limbo between awareness and responsiveness." Dr. Kim approached the case from a psychiatric perspective, wondering if we might be dealing with some form of conversion disorder or dissociative condition. But even his extensive background in psychological causes of neurological symptoms couldn't account for the patient's EEG findings and the complete absence of any psychological trauma or stressors in her background. We contacted her family and learned that she was Jessica Martinez, a 28-year-old graphic designer who lived alone but maintained close relationships with her parents and younger sister. According to everyone who knew her, Jessica was mentally healthy, professionally successful, and had no history of medical or psychiatric problems. She had gone to bed Sunday night after having dinner with her sister, and her family had no explanation for her condition. Her sister Maria was devastated when she arrived at the hospital. She sat beside Jessica's bed talking to her for hours, convinced that Jessica could hear every word despite her unresponsiveness. What was remarkable was that Jessica's EEG patterns showed distinct changes whenever Maria spoke, different from the changes we saw with medical staff or other visitors. "It's like her brain recognizes familiar voices," Dr. Williams observed as we watched the real-time monitoring. "The wave patterns become more complex and organized when family members are present, almost as if she's trying harder to respond to people she loves." By the third day, I was becoming obsessed with understanding Jessica's condition. I found myself staying late every night, reading research papers on consciousness, reviewing similar cases in medical literature, and spending hours just observing her for any subtle changes or responses we might have missed. The breakthrough came on Thursday evening when I decided to try something completely unconventional. Instead of conducting medical tests or asking clinical questions, I began reading to Jessica from a book I'd brought from home. It was a novel I had been enjoying, and I thought if she was truly conscious and aware, she might appreciate hearing something more interesting than medical discussions. The response was immediate and dramatic. Her EEG patterns became more intricate and organized than we had ever seen. Different regions of her brain showed increased activity that corresponded to language processing, emotional response, and even what appeared to be visual imagery activation, as if she was creating mental pictures of the story I was reading. More remarkably, when I paused at suspenseful moments in the narrative, her brain patterns would intensify, almost as if she was anticipating what would happen next. When I read emotional passages, the activity in areas associated with emotional processing would increase. Her brain was not just hearing the words, but fully engaging with the story on every level. I called Dr. Williams immediately to observe what was happening. She arrived within minutes and watched in amazement as Jessica's brain responded to literature in ways that suggested not just consciousness, but active, engaged thought processes. "This is extraordinary," she whispered as we monitored the patterns. Her brain is doing everything a fully conscious person's brain would do when listening to a story. She's processing language, creating mental imagery, experiencing emotions, and even showing patterns consistent with memory formation. But none of that activity is reaching her motor systems. Over the next few days, I continued reading to Jessica, and her responses became even more sophisticated. I started varying the types of content, reading poetry, news articles, technical papers, and even some of my old medical textbooks. Her brain patterns would shift and adapt to different types of material, showing increased activity in regions appropriate to the content type. When I read poetry, areas associated with rhythm and musical processing would activate. Technical material would engage regions involved in analytical thinking. Emotional content would light up the limbic system. It was as if we had a window into a fully functioning mind that was somehow disconnected from its ability to interact with the physical world. The most profound moment came when I decided to read her own medical chart to her, explaining in detail what we had found and what we thought might be happening to her. As I described her condition and our theories about her consciousness, her EEG patterns showed what could only be described as recognition and understanding. The activity in her frontal cortex, the area responsible for self-awareness and introspection, became highly organized and intense. It was as if she was processing information about herself and her condition with the same analytical capability she would have had if she were fully responsive. But what happened next changed everything. As I finished reading her chart and began explaining some of the treatment options we were considering, including the possibility of experimental procedures, her brain patterns suddenly shifted into something none of us had seen before. The organized mathematical precision that had characterized her EEG from the beginning became even more complex. But now there were new elements that seemed almost like attempts at communication. Rhythmic patterns that repeated in sequences, variations in amplitude that seemed purposeful rather than random. And most remarkably, changes that occurred in perfect synchronization with her heartbeat. Dr. Williams was monitoring the real-time display when she suddenly grabbed my arm. "Sarah, look at this. She's creating patterns that correlate with her cardiac rhythm. It's as if she's trying to use her autonomic nervous system to communicate since her voluntary motor system isn't responding." We watched in fascination as Jessica's brain seemed to be attempting to control functions that are normally automatic and unconscious. Her heart rate would increase and decrease in patterns that seemed too organized to be coincidental. Her breathing, which had been irregular since admission, began following rhythms that appeared to correspond to the complexity of what I was saying to her. I decided to test this theory by asking Jessica direct questions and watching for changes in her autonomic functions. "Can you hear me?" I asked. Within seconds, her heart rate increased by exactly 10 beats per minute, then returned to baseline. "Do you understand what's happening to you?" Again, a precise increase followed by return to normal. We had discovered that Jessica was not only conscious and aware, but had somehow learned to communicate using the only physiological systems she could still influence. It was as if her consciousness had found a backdoor way to interact with the world when the main pathways were blocked. The implications were staggering. If Jessica could control her autonomic functions consciously, it suggested a level of mind-body connection that exceeded anything described in medical literature. She had essentially rewired her own neural pathways to create a communication system using functions that are typically beyond voluntary control. Over the following days, we developed a rudimentary communication protocol based on her heart rate and breathing patterns. 1 increase for yes, 2 for no, longer changes for more complex responses. It was crude, but it worked. For the first time since her admission, Jessica could tell us about her experience. What we learned was both fascinating and deeply disturbing. Jessica was fully conscious and aware of everything happening around her. She could hear every conversation, understand every procedure, and experience every sensation. She had been trapped inside her own body, completely aware but unable to move or speak, for over a week. But what troubled me most was her response when I asked if she knew what had caused her condition. Using our communication system, she indicated yes. When I asked if it was something medical, she indicated no. When I asked if someone had done this to her, her heart rate spiked in a way that could only be interpreted as extreme distress. I realized we weren't just dealing with a medical mystery. We might be looking at the result of something deliberately done to Jessica. something that had left her consciousness intact while severing her connection to voluntary physical control. But what could possibly cause such a precise and devastating effect on the human nervous system? As I pondered these questions, I began to notice that I was being watched during my visits with Jessica. Hospital security cameras were positioned throughout the building, but seeing I start the same faces in corridors near the neurological unit. People who claimed to be visiting other patients but seemed unusually interested in Jessica's room. The case that had started as a medical mystery was evolving into something far more complex and potentially dangerous. And I was beginning to suspect that Jessica's condition might not be the result of some unknown neurological disorder, but something far more sinister that someone very much wanted to keep secret. My suspicions were confirmed the next morning when I arrived at the hospital to find Jessica's room under police guard. Detective Maria Santos from LAPD was waiting for me in the hallway, her expression grim as she approached with a file folder tucked under her arm. "Dr. Chen, we need to talk about your patient. We've received some information that suggests Jessica Martinez's condition may not be accidental. I'd like to review her case with you and discuss what you've observed during her stay here." Detective Santos had been investigating a series of unusual cases across Los Angeles, involving young professionals who had experienced sudden, unexplained neurological symptoms. In each case, the victims had been found in their homes with no signs of trauma or forced entry, presenting with conditions that defied medical explanation. What made Jessica's case particularly significant was that she was the first victim to survive whatever had been done to her. The previous cases had all resulted in death within 72 hours, with autopsies revealing no clear cause of death and no evidence of poisoning or physical harm. We have reason to believe that someone has developed a method of inducing these neurological conditions deliberately, Detective Santos explained as we reviewed the files. The precision of the symptoms, the lack of any identifiable cause, and the fact that all victims were successful, young professionals suggest this isn't random. The detective showed me photos and medical records from the other cases. Each victim had presented with different neurological symptoms, but all shared certain characteristics that were now chillingly familiar. Normal brain imaging, normal blood work, and EEG patterns that showed organized brain activity despite clinical presentations that suggested severe neurological compromise. Dr. Chen, based on your observations of Jessica's condition and her apparent ability to communicate through autonomic responses, we believe she may be able to help us identify who did this to her. Would you be willing to assist us in questioning her using the communication system you've developed? I agreed to help, though I was deeply concerned about the psychological impact on Jessica of reliving whatever trauma had caused her condition. We arranged for a session the following afternoon, with Detective Santos, a police psychologist, and Dr. Williams present to monitor Jessica's responses. When we began the questioning, Jessica's immediate distress was evident in her heart rate and breathing patterns, but she seemed determined to cooperate, perhaps understanding that her information might prevent others from suffering the same fate. Using our established communication protocol, we learned that Jessica had been approached by someone claiming to be conducting medical research. She had been offered significant compensation to participate in what was described as a non-invasive neurological study that would involve only monitoring her brain activity while she performed simple tasks. The person who contacted her had extensive knowledge of neuroscience and had provided credentials from what appeared to be a legitimate research institution. Jessica had agreed to participate because compensation would then help her pay off student loans. And the research sounded fascinating to someone with her analytical background. The session had taken place in what appeared to be a professional medical facility. Jessica remembered being connected to monitoring equipment and being given what she was told were harmless supplements to enhance her brain's electrical activity for better data collection. But something had gone wrong during the session. Instead of the simple cognitive tests she had been promised, Jessica found herself unable to move or speak. The researchers, rather than helping her or calling for medical assistance, had simply monitored her condition and taken extensive measurements of her brain activity. Detective Santos pressed for more specific details about the location and the people involved. Through our painstaking communication process, Jessica was able to provide descriptions of the facility and the individuals who had conducted the experiment. What emerged was a picture of an underground research operation that was using human subjects to test some form of neurological manipulation technique. The goal appeared to be developing methods of inducing specific altered states of consciousness while leaving the subjects technically alive and their brains functional. The implications were terrifying. Someone had developed a way to essentially disconnect consciousness from voluntary physical control, creating a state where the mind remained fully aware but trapped within an unresponsive body. It was a form of torture that left no physical evidence and could potentially be used for interrogation or punishment without detection. Jessica's case was unique because whatever they had done to her had been partially reversible. While she couldn't regain voluntary motor control, her consciousness had found ways to communicate through autonomic functions that the procedure hadn't completely severed. As we continued gathering information from Jessica, I began to notice changes in the hospital environment that made me increasingly uncomfortable. Staff members I didn't recognize were appearing in our unit, claiming to be consultants or researchers interested in Jessica's case. Security guards who had never worked our floor before were suddenly assigned to the neurological wing. Most disturbing was the pressure I began receiving from hospital administration to transfer Jessica to a different facility or to consider experimental treatments that would require moving her to locations outside the hospital. The justifications sounded reasonable, but something about the timing and persistence of these suggestions felt wrong. Dr. Williams shared my concerns and suggested we document everything about Jessica's condition and our findings before any transfer could be arranged. We spent that evening creating detailed recordings of her EEG patterns, her communication responses, and our observations about her unique neurological state. That was 3 years ago. Jessica Martinez recovered most of her motor function after 6 months of intensive therapy, though she still experiences occasional episodes where her voluntary movements become limited. The underground research facility was never found. Detective Santos's investigation was quietly closed after she was transferred to a different department. The hospital administration convinced Jessica's family that pursuing legal action would be detrimental to her recovery. I moved to a small town in Oregon where I practice general medicine and try not to think about the cases that defied explanation. But sometimes, late at night, I wonder how many other Jessicas are out there, trapped in their own bodies, waiting for someone to discover that consciousness can be weaponized in ways we never imagined. The human brain remains the most mysterious organ we have, and Jessica's case taught me that some mysteries are deliberately hidden from us. If you've experienced anything similar or know someone who has, please reach out to local authorities. And remember, not every medical mystery has a medical explanation. Sometimes the most impossible cases reveal truths that someone desperately wants to keep buried.